Spot treatments are skincare products designed to target and treat specific problem areas, such as acne, dark spots, or blemishes, rather than being applied to the entire face. These treatments often contain concentrated active ingredients like benzoyl peroxide, salicylic acid, sulfur, niacinamide, or hydroquinone, depending on the skin concern. For acne, salicylic acid and benzoyl peroxide help to reduce inflammation and kill acne-causing bacteria. For hyperpigmentation or dark spots, ingredients like vitamin C, niacinamide, and hydroquinone are commonly used to lighten and even out skin tone. Spot treatments are best applied after cleansing and before moisturizing, directly on the affected area, to maximize their effectiveness. When choosing a spot treatment, it's important to consider your skin type and sensitivity. Overuse or applying harsh ingredients on healthy skin can lead to dryness, irritation, or peeling. For sensitive skin, gentler alternatives like tea tree oil or azelaic acid may be more suitable. It's also essential to be patient, as spot treatments usually take time to show visible results, typically a few days to weeks depending on the severity of the condition. Always follow up with sunscreen during the day, especially when using ingredients that increase sun sensitivity, such as retinol or hydroquinone. With consistent use and proper skin care, spot treatments can effectively reduce breakouts and discoloration for a clearer, healthier complexion. Spot treatments are best applied after cleansing and before moisturizing, directly on the affected area, to maximize their effect.